Talks, I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Obsessive-compulsive disorder linked to heightened risk of death. People with obsessive-compulsive disorder, that is OCD, may have an increased risk of death from both natural and unnatural causes than those without the disorder, finds a study from Sweden published in the BMJ. The researchers point out that many of the natural causes of death are preventable, suggesting that better surveillance, prevention, and early intervention strategies should be implemented to reduce the risk of fatal outcomes in people with OCD. OCD is typically a long-term psychiatric disorder affecting about 2% of the population. It is characterized by intrusive thoughts, urges, or images that trigger high level of anxiety and other distressing feelings, which are known as obsessions, that the person tries to neutralize by engaging in repetitive behaviors or rituals, known as compulsions. OCD is also associated with academic underachievement, poor work prospects, alcohol and substance use disorders, and an increased risk of death. Previous studies on specific causes of death in OCD have mainly focused on unnatural causes, such as suicide, but little is known about specific natural causes.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Researchers find anti-HIV drugs may prevent complications from bacterial sepsis. Bacterial infections can lead to the formation of abscesses, pockets of dead cells and debris surrounded by inflammatory immune cells. Bacteria multiply within abscesses, causing more inflammation and further damage to surrounding tissues. In severe cases, these immune reactions spread across the body, resulting in life-threatening organ failure or sepsis. But how these abscesses form and what can be done to prevent them were previously not well understood. Using preclinical models, investigators from Brigham and Women's Hospital, a founding member of the Mass General Brigham healthcare system, identified a key mechanism that may be driving liver abscess formation, a process known as reverse transcription, in which DNA is synthesized using RNA. Using RNA sequencing, the researchers examined liver gene transcripts from mice infected with E. coli. They found that abscess formation was associated with increased expression from endogenous retrovirus, that are the ERVs, remnants of viruses that integrated into the mouse genome following past infections. The study is published in the PNAS journal. For people with migraine, feelings of stigma may impact disability and quality of life. Migraine can impact many aspects of a person's life, but less is known about how feelings of stigma around the disease can affect quality of life. For people with migraine, these feelings of stigma were linked to more disability, increased disease burden, and reduced quality of life, according to new research published in the January 17, 2024 online issue of Neurology, the medical journal of the American Academy of Neurology. Stigma is common where the disease is not readily apparent to others, and there is indication that it could be especially relevant for those living with migraine, said study author Robert Evans Saferio, MD PhD of the University of Vermont and the Fellow of American Academy of Neurology. This stigma may arise when a person with migraine recognizes negative stereotypes about the disease and experiences shame for having the disease, fear of experiencing stigma from others, or negative emotions. For the study, researchers looked at the 59,001 people with migraine with an average age of 41. Among all participants, 41% reported experiencing 4 or more headaches a day per month on average. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.